This is one of my favorite medications to talk about. So if you're on a statin medication or if you have been scared about taking one, then this video is for you. It's to help calm the noise and really give you the facts that you need in plain language. And please stay to the end, y'all, because I'm going to show you the impact and talk to you about how I keep in my brain, my pharmacist brain, the difference between lipophilic, fat-loving versus hydrophilic, water-loving statins, and why switching the type can sometimes be helpful if you're dealing with side effects. Now, if you are new to my channel, hello, and thank you for joining. My name is Dr. Wallace-Gay. I am a clinical primary care pharmacist, and I have seen so many people that are on statins and do wonderfully. I've seen people that are nervous to take statins, and I jokingly call myself the statin whisperer in clinic because I really believe that once I go in and talk to a patient that I've been consulted on and really help them understand how these statins work, not just for lowering your cholesterol numbers, but also for lowering risk of things like heart attack and stroke, then that fear, that misinformation, those perceived risk that they've heard from a friend or family member, all seems to be quiet and calmed, and we can literally manage that in a way that helps reduce your risk in the long term. Now, I want to make sure that I am clear that this video is for education and is not personal medical advice, so always talk to your clinician. But I will tell y'all, I like a lot of different medications. If you are going to take medications or if you are in a situation where medications are going to quite literally save your life, then as a pharmacist, I want to make sure that you are using them appropriately and that you have the right information to take control of your health and your medications. So the things that the statins are working on. So you guys have all probably heard of LDL, which is your low density lipoprotein type of cholesterol. And LDL is what we consider bad cholesterol. But think of LDL as like a little delivery truck. It carries cholesterol through your bloodstream. And when there's too much LDL, some of it can end up in the walls of the arteries, and that can contribute to plaques. Those plaques on the walls of your arteries can sometimes, it's like gunk in a pipe. So blood's not going to be able to flow through as freely as it did before. Also, sometimes those blocks can break off and mobilize and end up leading to blockages, which can cause things like strokes. And so we really want to make sure that we are limiting or minimizing LDL so that we are limiting and minimizing our risk of developing those plaques. Statins specifically help lower LDL and reduce that risk. Another really important thing to keep in mind is that cholesterol synthesis or cholesterol formation occurs in the liver. Most of that happens at night, but it can happen at any time. And so what statin medications do is they block a protein or an enzyme that allows for cholesterol to be produced. And so if we block that enzyme, then less cholesterol is going to be produced. If less cholesterol is going to be produced, the liver will pull that from somewhere else. So it will then pull LDL from the bloodstream and use that instead of making more bad cholesterol. So statins are going to help lower your LDL, reduce your risk of things like heart attack and stroke. And this is going to be really important, especially in people who already have existing heart disease or in those who have what we consider strong risk factors. Now, there are a lot of different things that fall into that strong risk factors category. At the end of the day, unless you've already had some type of cardio event, then it's really going to be a shared decision with your practitioner. So, for example, if you are someone who has a high LDL level, like 194, you might have that conversation with your practitioner. Should you start a statin? Most people are going to do lifestyle for a little bit before they go on a statin, which is appropriate, absolutely appropriate to watch your diet or adjust your diet, I should say, and incorporate more physical activity. If you are someone who has diabetes and you're over the age of 40, we know that your risk of having a heart attack or a stroke is already higher. And so the statins can help reduce that risk. But again, that becomes a conversation with you and your healthcare practitioner about whether or not you want to go ahead and start on that statin now, or if you want to try to implement some lifestyle changes and hold off on the statin. When we talk about reducing the risk, we're really talking about your 10-year risk. And so that's something that comes into discussion as well, because we've had patients that are older, 85 years old, and they're like, I don't take a statin. And I'm like, cool, that's fine with me. And then I also want to throw out there that there are multiple different options on the spectrum of statins. And so we have different levels of dosing that we can give you. Depending on what your risk is, we may give you what we call a low intensity statin dose, a moderate intensity statin dose, or a high intensity statin dose. And that's all going to be based on what that 10-year risk is or what your overall risk is of having a heart attack or a stroke. And you can Google American Heart Association 10-year risk reduction and plug your own numbers in to see what your risk of having a heart attack or a stroke is within the next 10 years. Make sure that you get that in context, because we know that information without context can be a dangerous thing. So once you get that information, you can then take that and have a conversation with your practitioner about it to determine whether or not you want to be on a statin. In our big guideline documents, the strongest case is going to be for people who have already had cardiovascular disease or some heart event. We definitely believe that statins are going to be the cornerstone of your therapy, and we see the data that supports that. Again, for those other people, like if you have diabetes and you're over 40, if you have a very high LDL level, if that calculated risk is a bit elevated, then just have that shared decision conversation with your healthcare practitioner. Ask the right questions, determine which statin is going to be best for you based on your overall risk and your overall goals. But I do want to drive home the fact that these statins are very different. So I'm just going to throw out a few doses. If you are on atorvastatin 40 or atorvastatin 80, or if you are on rosuvastatin 20 or rosuvastatin 40, you are on a high intensity statin dose. That is going to be a little bit different than your friend or your cousin or your aunt who might be on atorvastatin 10 or 20 or rosuvastatin 5 or 10 or simvastatin 20 or 40 milligrams. Those are all considered moderate intensity statin doses. And the list goes on and on for moderate and low intensity. But just know that we talk about statin doses in terms of intensity, which is how much they typically will lower the LDL. So if you're on a high intensity statin, that means that we want to lower your LDL by at least 50%. And those doses have been shown to do that. If you're on a moderate intensity statin, then that means we can lower your LDL by up to 30%. And if you're on low intensity statin, then we can lower, if you're on moderate intensity, we're going to lower it between 30 and 50%. If you're on high intensity, 50% or more. And if you're on low intensity, it'll be less than 30% that we need to lower your LDL. So most people are on a moderate or high intensity statin. So again, if someone that you know says that they're on a statin, then it really matters what dose they're on and which statin they're on, because they're all very different. Now I want to talk about side effects, because this is the one that I feel like I have to talk people through a lot. One of the big ones is muscle aches. Now, with muscle aches, you have to check the timing of the dose. Are there other things that could be causing muscle aches? And if you are sure, and some people are, they are very sure that it is the statin that's causing the muscle pain, then we may be able to adjust the dose. So if you're on a high intensity, we can put you on a moderate intensity. We may be able to switch the statin. And so this is where that lipophilicity or fat-loving versus hydrophilicity or water-loving note comes into play. So for medications that are very fat-loving, these are things like simvastatin. It's probably one of the main ones that we use that's very fat-loving. It's one of the older statins as well, more closely linked to the natural substance. So simvastatin is going to get into the muscles a lot easier, into other tissues of the body, the brain, etc., all over a lot easier because it is fat-loving. And all of our organs and tissues of our bodies have some fat component to it. And so medications that are lipophilic or fat-loving love to come out of the blood, which is more water, and into the tissues where there's more fat. So simvastatin will cause more muscle aches and pains because it is going into the muscles more often, versus medications like atorvastatin, which is kind of in the middle of the line. It's a little more hydrophilic or water-loving, but it has a little bit of fat-loving with it. And then other ones like rosuvastatin or pravastatin, which are very hydrophilic, water-loving, which means they want to stay in the bloodstream. So they have a lot less muscle aches and pains, a lot less side effects associated with liver and things like that, because they are primarily staying in the blood and doing their job there. So muscle aches is a thing that can happen, but we may be able to lower your dose or switch you to a different agent if that is an issue. Now, if you notice that you have dark urine, if you are severely weak, if you have a fever, that calls for urgent evaluation. That means that you may be dealing with something called rhabdomyolysis, which is a rare, very rare, but very serious muscle breakdown issue. and you need to be checked on immediately. We also may see some liver symptoms with these medications. We often see a slight bump in your liver enzyme number, so ALT and AST. That's to be expected because these medications are working on a process that's occurring in the liver. But if you start to notice yellowing of the eyes, severe fatigue, right upper quadrant pain in the abdominal area, then you definitely need to be evaluated quickly for that as well. So I don't want you to be afraid. No, just know that muscle symptoms can occur. Some people do get muscle aches, but large analyses show us that the statin is responsible for a very minority amount of those muscle symptoms. Oftentimes it's something else, but we do acknowledge that that can occur, and we can make adjustments in your medication for that while also still giving you the benefit of what we know statins can do for you. So what I want you to hear is if you notice any symptoms, the next step usually is not to just stop it abruptly and never take it again. It's to talk with us so that we can troubleshoot and figure out how to maintain your benefit while significantly reducing any risk that you're having or any symptoms that you're having. Statin medications can also slightly increase the blood sugar in some people, but that's not that common. And the cardiovascular or the heart protection that we get outweighs the risk of potentially increasing the blood sugar a little bit. So we usually take that with a grain of salt. I do want you to go back, talk to your clinicians and tell them, I want heart protection, but I want to minimize my side effects. So you can talk to them and say, what's our plan here? I don't want to be on simvastatin because it is causing me issues, but can I switch to a more hydrophilic statin like rosuvastatin or atorvastatin and maintain the benefits that I need? Now, I would be remiss if I did not talk about drug interactions. Statins do have quite a few drug interactions just because they are broken down by one of the main enzymes or proteins that breaks down a lot of medication. So some antibiotics and antifungals are going to interact with statins. HIV medications are going to interact with statins. Grapefruit and grapefruit juice are going to interact with statins, especially simvastatin, lovastatin, and atorvastatin are the main three that you have to worry about grapefruit juice with. Medications like gemfibrozil, which is also used for cholesterol issues, mostly lowering your triglycerides. So if you have high triglycerides and they want to put you on what we call a fibrate medication, we usually try to stay away from gemfibrozil if you're already on a statin. So things like that you do want to watch out for, but most of those side effects are going to be because of the interaction with the protein that would break down the statin. Now that protein is not available because of these other drugs. So that means that the statin drug potentially could build up in your body, the levels of it, and then that's going to increase your risk of having certain side effects. Anytime you start a new medication, even if you're taking something over the counter, just double check with your pharmacist or your primary care practitioner to make sure that it is not something that's interacting with your statin medication. Quick recap, statins are going to lower your LDL. We need that. That's lowering our bad cholesterol, pulling it out of the blood. They're going to reduce your risk of cardiovascular conditions such as heart attack, stroke. They are probably one of the most studied medications that we have. So we know a lot about them. They're derived from natural substances. I didn't even get into red yeast rice. So if you made it this far in the video, red yeast rice is the natural statin. You can buy it over the counter. It's very chemically similar to lovastatin, but also still very similar to the other statins as well. So if you're a natural person, that's a conversation that you can have with your practitioner about red yeast rice. Now, it's not going to give you the same high-level protection as some of the prescription medications like rosuvastatin or atorvastatin, but again, if you are someone who could use a low-intensity statin, you might want to do red yeast rice. So I'll just leave it at that just because I did not build that into this particular video, and I'll do a whole totally different video later about different supplements and things like that. We know that side effects can happen, but we do have options, so I just want you to keep that in mind. And if you haven't already, please grab my free medication mind map. Helps you just map out things like this. What meds you're on, what are the side effects, how does that medication work, and where is it working, and why that matters for you. What are the labs you need to look out for? So all of that can be looked at and mapped out in the med map guide. And we also know that just writing things down scientifically, we know that it helps you retain information and understand it a lot better so that you can go off, ask better questions, and begin to act, ask, and be the CEO of your healthcare. Thank you for watching. I'll see you in the next one.